Amid worries in the White House and caution in emergency rooms, there's disagreement about the state's reopening and how they're doing it, as we know. So let's speak to a professional on the front line, emergency medicine physician, Dr. Kalsi, who's in Naperville, Illinois. Doctor, good to see you this morning. Thank you for joining us. So we know the CDC recommendations for reopening. The White House says they're too restrictive. You heard Jim lay that out. They're now being edited, as we know. As an ER doctor, what do you think of these guidelines?
So I reviewed some of the guidelines, and Robin, first of all, thank you for having me back.
Nice to see you.
I can lead with Happy Nurses Week to the amazing nurses out there, and Happy Teacher Appreciation Week. The guidelines are pretty broad, and I was looking at some of them that include schools and how we're going to process students and education, how they're going to go to lunch, and how they're going to isolate certain groups of kids from other groups, to bars and restaurants. I do agree that this will have to be unique to every state, including different demographics and different settings. In a congested city like Chicago, New York, there might be different rules than, say, rural Montana. And I don't think we can apply one rule to every single population.
Yeah, that's interesting. So we also know that that's what's played out on a macro level in the US, that there's been this sort of ad hoc, well, sort of these patchwork response by the states. You're in a state that's been on solid lockdown for weeks, but then 47 states are easing restrictions this week. I mean, do you think that should be happening? Or is it the same premise that each state is at a different place, therefore they can make their own decisions on where they are?
I think it's a great question. I think that releasing social distancing and relaxing all of these rules is entirely arbitrary. This virus is not contained. And if you remember 2 months ago when we just started hearing about coronavirus, and 3 months ago when we started hearing about it internationally, people will remember that there were just very few cases. There was initially 1 or 2 cases in the United States, and that quickly grew to thousands, and now we have nearly 80,000 in under 6 weeks. That will start again. Once you release distancing and relax everything, it's just going to start again until we have a way to mitigate the virus itself. And once you get the virus, control the catastrophic problems that some people will have with the virus.
Yeah, I mean, it's certainly desperate times. And again, those projections of numbers, particularly here in the US, are also startling. We know that hospitals have stopped doing elective surgery, but we also know that people are afraid to come into hospital for other conditions, that kids aren't getting immunized. How much broader is the impact of this on the health of communities and people?
It's huge. And if I could take a moment to implore America, as a doctor and as a human being that has a doctor myself, America, if you need to come to the emergency room, come to the emergency room. It is safe. We will make you safe. Yes, there is coronavirus, there is COVID-19 in emergency rooms, but you need to seek emergency care like you used to. I get phone calls all the time. Is it safe to come to your ER? Doctor, is it safe to come there? Yes. Come to the ER. Do not wait. What we're seeing now, Robin, is new waves of mortality. We are seeing people who've waited with their chest pain, people who've waited with abdominal pain, and they're having catastrophic problems. And some are dying at home. In certain areas of the country, we're getting more calls about people being found dead in their homes. And we really encourage people to just come to the emergency room like you would have in the first place. If you don't know what to do, call us in the emergency room or call your primary doctor. And two, as we don't do elective surgeries, we need to realize that elective surgeries are the primary way that hospitals make money. And that money is then sent to all of our healthcare workers. And if the hospitals don't make that revenue, we don't pay our healthcare workers, and we are hemorrhaging money across the country. This is just a fact. At some point, we need to start elective surgeries again, and people need their elective surgeries for a reason. And that third wave of mortality is people that delayed those surgeries, that get sicker with the illnesses that they needed them for.
And also, there's one other thing I wanted to ask you before you go. It's Mother's Day here in the US and in some places across the world on Sunday. You know, there's so much being discussed about mental health and about isolation, particularly of the elderly. Should people go and visit their moms or give grannies a hug? What should people do on Sunday?
You know, I know this is hard. I have the blessing of having both my parents with me. My wife has both her parents with her, and we are not going to go visit our parents. We're going to FaceTime with them. We're going to Zoom with them. I need to reiterate to everyone out there that is looking to doctors and healthcare workers on this very important piece of advice: restrict yourself from visiting those that are frail, vulnerable, have multiple medical problems. They are still just as vulnerable on Mother's Day as they were on Easter. And I'll tell you, Robin, we have families ventilated who gathered around Easter, and they're fighting for their lives now.
Okay, so you don't want that legacy from Mother's Day. Dr. Raj Kalsi, great advice. Thank you for joining us here. Thanks for speaking to us.
Thanks, Robin. Be safe.
Yeah, you too.